All right. Hello, everyone. Thank you so very much for joining us for another Facebook Live Town Hall. My name's Kyle Mayer. I serve as Deputy Communications Director here with Team Celeste, and I'm joined, of course, by our candidates of the hour, Celeste Williams and Daisy Bonilla. This afternoon, we will be talking health and well-being in the time of COVID and the process engaging the perspectives of two health professionals in the NWA metro area, and then also fielding questions from the audience. So as we're conversing, please be thinking, share your thoughts with us in the comments section, and we will try to get to as many as we can within the allotted time that we have today. Thank you again for bearing with us. We had some technical difficulties at the outset, but are hopeful, fingers crossed, that things end up turning out all right. So hello, everyone. Welcome. Everyone here, hopefully, ideally, knows our candidate for Congress, Celeste Williams. Celeste is a nurse practitioner in Bella Vista. We're joined today by Daisy Bonilla, who is a candidate in Arkansas's 93rd House District from Bentonville, and she is a social worker. So Daisy, thank you so very much for being here. We're so excited to talk health and well-being with you. And we'll just go ahead and get started. Yes, please ask questions. Thanks, Stephanie, for putting that in the comments. All right, so Celeste. I'm sorry, yeah, of course. Celeste, you're up first. Celeste is a nurse practitioner, as well as a candidate for Congress. And we are all watching the COVID case number skyrocket in Northwest Arkansas day in, day out. Washington Regional just this week called contextualize what we're seeing as a serious public health emergency. I'm wondering what you're seeing on the front lines of your profession day in, day out.
So first, Kyle, thank you so much for leading us today. And thank you everyone for joining us. And so yes, as Kyle said, I am a family nurse practitioner. And so, working in family practice, my view is probably a little bit different than say that from a nurse in a hospital. And so, part of what I am seeing, one, is just within the community, a lot of fear and concern about either a person themselves' health, or fear or concern about a friend or family member that they're worried about. So I try really hard to keep up to date with what is happening in the facilities all around us in Northwest Arkansas. So, Washington Regional is obviously really concerned if they're putting out that public statement. I have contacts within all the other area facilities, and they too are really concerned about the increased number of people who are testing positive, the increased number of hospital admissions, and the increased number of ICU admissions. Which, one of the things that you don't hear in media releases is also a real concern about running out of resources that are needed for taking care of critical care patients. Making sure that there's enough PPE on hand, personal protective equipment is what that stands for, so that nurses have, all the needed tubing for IVs and for the circuit for a ventilator patient, which is artificially breathing for someone. And if we run out of those supplies, we're in a real problem. And so that is something that I've heard expressed from some of my fellow nurses within the community, is that real concern of running out of needed supplies. And so I think it's really important for each and every one of us to do our part to help get our community through this situation. And again, that goes back to really basic things like staying home if you can. Certainly don't go anywhere if you are not well. It's pretty simple to check your temperature, and if you have a fever, then you should not be out and about. If you have symptoms, you should contact your primary care provider and make sure that you get a test. There are also testing facilities available that you can go just get a free test. And so those, I shouldn't say free, you can go get a test. And so it's really important for us to do those hand sanitizing, social distancing, stay home if you're sick.
Absolutely. It's so tough not to just look at these numbers and feel your heart drop. And I think that we are all forgetful at times that
Yeah.
behind each and every number, there are resources being dedicated to these patients, and that the reality is that that's a limited supply. So thank you for that perspective. Um, as a quick follow-up, describe to us your level of concern about this continued increase in cases. And then if you could, couple that concern with your perspective on moving to phase 2 reopening this coming Monday.
So I think it's very concerning. I do not think that in this area we need to increase um, the amount of contact that people are having with one another. And, I am encouraged that there are some good studies coming out showing the effectiveness of mask usage. And so
Mm.
that's something we should probably all remind ourselves and everyone else around us is really rely on those masks to help reduce the spread of COVID-19. That said, I'm still very concerned about further opening up, and I think that it does increase our risk of worsening the problem.
Well, I guess the good news here is that these best practices haven't changed, and we just have to keep on hammering home that social distancing and mask wearing works and is effective. All right, thank you, Celeste. Daisy, moving on. As a social worker and community advocate, what are you seeing? What are some of the challenges that our community is so uniquely facing right now?
Well, thank you, Celeste, for having me. But some of the things that I am seeing in my practice, it's kind of rampant, is the homelessness that's happening right now. I have a few patients who are on the verge of losing their home. One in particular that stands out to me is in her 60s, and she literally just got kicked out of her home. The shelters we have in place in this area are full, or many are in place for victims of domestic violence and abuse. And it is a double-edged sword because thankfully my patient isn't going through something like that, but that means she doesn't meet the qualifications either. And I know our governor thinks that the landlords will make the empathetic decision during this time, but in reality, we need a moratorium on rent, on mortgage, on evictions, so vulnerable people won't be placed more at risk. Our economy is suffering. People need assistance and to be able to breathe easily. And while some of us are privileged enough to be able to work from home, many in our community can't. And they also can't afford to get sick. So we need to be proactive in preventing a homeless crisis in our area, not creating it.
Absolutely. I think it's often lost on us that if we are not experiencing the direct economic impacts of this crisis, that I think is often framed as a public health issue more than anything, that there are people out here suffering on multiple fronts. So Daisy, thank you for that very important reminder. Celeste, what recommendations do you have as a nurse for folks who want to mitigate risk and protect themselves, their families, and the community as much as they can at this time?
I think it just goes back to those same basic principles of staying home, washing your hands, wearing a mask, don't go anywhere if you're sick. And I've said this in other live streams that I very much liken this to our conversations that we got when we were kids about sex education. Abstinence is number one. You're not going to catch this disease if you abstain. But people being people and wanting to get together, it is really important to use your protection, which in this case is a mask. So, those are the basic things that we need to be doing.
Well, let's hope that language ends up getting across. That's an accurate comparison. Thank you very much for that. All right. So, Daisy, we know that this has been a very difficult time for many people here in the 3rd District. What are some of the social and emotional challenges? You mentioned fiscal just a few seconds ago that you're seeing in this pandemic. And do you have any recommendations for how folks out there can better practice self-care?
Sure. So something that we recognize is that physical distance is affecting how families and people can be together. So it is a time when people can't see their friends or loved ones, and they can't participate in activities or sports. And so we are seeing people in crisis. People are experiencing intense emotions like anxiety or depression, or turning to substances in order to cope. And people need connection. They need to feel a sense of community, which tend to increase feelings of well-being. So it's important for people to remember that by physically distancing, we are taking care of our community, and we have to protect one another, but that doesn't mean that we have to be disconnected. So as depending on how you communicate, if it's through phone, if it's through Zoom, we can still make connections. And as far as self-care is concerned, we are experiencing a disruption in our routine. So control what you can control and rely on. Try and stick to a routine at home. Have your own retreat space, especially for kids. Help them identify a place in the home that they can go be calm and relax. They have that at school. They can also have that at home. When they're feeling stressed or overwhelmed, make it cozy, make it colorful, make it fun, for whatever's going to make them comfortable. And then rely on the supports that you have, your friends, your family. If church and prayer help, turn to that. Things to get you out of your head to really help bring your anxiety and fears down. Long-term projects are a really good idea. Hobbies like knitting, painting, running. And something that we've been telling our patients is limit your screen time. Social media and the news can really exacerbate this anxiety and this fear. So we recommend treating them like meal times, 30 minutes a day, 2 to 3 times a day. So if you wake up and you see the news, during lunchtime you can check on the updates, dinner time you can't do. That's it. And whether it's social media or news, pick which ones you combine. If you do all news or if you do social media, that's completely up to you, but that's important to limit. We don't know what the future is going to have in store for us. So we assume often that we do, but we have to stay focused on the present, one day at a time. Rely on the strengths around us to get us through. And most importantly, don't be afraid to reach out for help. That being said, I do want to highlight that in the time when we need help the most, we are seeing that supports are also at risk. Arkansas's educator self-funded plans through Blue Cross Blue Shield will be terminating telehealth, which is virtual video and audio conferencing, benefits starting this Monday, and that's for employees and teachers, state employees and teachers. And that's a real concern. We need, as the numbers increase, especially in Northwest Arkansas, and we prepare for phase 2, healthcare providers need to be able to provide services in the safest way. So during a time when we are seeing insufficient and delayed federal funding, we need to advocate for our community and hold our leadership accountable.
What tremendous, sorry, so let's go ahead. Absolutely.
So I just wanted to piggyback off of what she said. I'm going to put my nurse practitioner hat on for just a moment. And in my practice, I am still working, and I have seen a tremendous increase in anxiety and depression and substance misuse. And I think it is incredibly important that people know the resources that are available to them. And oftentimes, they can start with their primary care providers. And a lot of us who work in family practice or primary care do treat a lot of anxiety and depression. And when I'm talking to my patients, I always let them know, it is normal to have a lot of stress and worry during this time. But it becomes problematic if it is affecting different roles in your life. So if your ability to parent, to be a good spouse, and to function at work are being affected, then it's probably time to talk about getting some help. And, that doesn't necessarily mean coming into the clinic, because we're doing a lot of telehealth now. And so most providers are able to schedule online appointments that they can, make an appointment and do that from the safety and comfort of your own home. And it's important to know that that resource is available, as well as a lot of counselors now are also doing video visits. And so, even though we are still in a pandemic, the safest thing we can do is avoid contact with others. We can still get the help that we need by doing that.
Hmm. What terrific advice. I think it's so easy for us to get caught up in our own little world of stress and worry sometimes, particularly in the days that we're all living through now. But I mean, I find myself picking up the phone and calling friends that I haven't spoken to in months now, just because I had so craved an interaction. Daisy, thank you for that important reminder. Celeste, you mentioned briefly the opportunity at reaching out to resources in the community. This is a question, I guess, for both of you. When we're thinking about the resource landscape in Northwest Arkansas, what resources might be stretched thin in these times and which are equipped to handle a greater intake and interest in their services, where do you recommend that folks look to be serviced, to find a home and to work through these issues that we're talking about?
When you say a home, do you mean like a physical place to live and dwell, or do you mean like a healthcare home?
Let's we can take it from both angles. I think, Celeste, you're probably more able to speak to the healthcare side, and Daisy, yourself, the social work side. So yeah, just go ahead.
So
Well, I can. Okay.
I'll go first, Daisy.
Well, I would say HARC, Northwest Arkansas, is a tremendous resource. It just pulls together all of the resources in our area, and it's a good starting point to start there and just ask for guidance. As far as mental health is concerned, I want to point out that Ozark Guidance, who's now Arista Health, I believe, along with Washington County, are providing free support groups for patients or people who have tested positive for COVID-19, but are also providing free support groups for healthcare workers. So that's a tremendous resource that we have in this area, as well as Easton Counseling and Associates, Youth Bridge. We have various, Ozark Guidance, we have various places where you can seek mental health resources.
I think that was great advice.
It certainly was. And for all of you who are viewing right now and are sort of trying to digest all this information and resources that we're throwing at you, don't worry. This will be posted. Feel free to peruse at your leisure. I certainly will be revisiting in due time. All right. So I think in our last 10 or so minutes, we'll go ahead and start talking through the questions that we've gotten in our comments. The first question that pops up is from Gwen Terry, and Gwen asks, if that's a concern, what is the governor doing to stock up on PPEs? This, I think, was probably in response to Celeste's point about dwindling supplies and the possibility of a shortage. It's better to have more than not enough.
So I'm going to take that from a federal perspective since I'm running for a federal office. We do not have a nationally coordinated plan. And so what is happening is that the state has obtained some needed supplies, but we still have private hospitals all competing against one another to purchase the supplies that they need. So they're not only competing against one another, so like Northwest is competing against Washington Regional and Mercy, but they are also competing against state and federal agencies that are also trying to procure these supplies. So I have from the beginning and will continue to advocate for a federal plan to make sure that everyone gets the supplies that they need. And I think it is crazy right now that we are competing against one another to get what we need to take care of our community members. So that's certainly one big point that I would make right there.
Right. That is ridiculous. I don't think I realized the extent to which these resources are fought over. And that certainly is not a perspective that I hope for any sort of healthcare provider in this crisis in particular. I have another question from Lori Hodge. Lori asks, Celeste, what are your thoughts about kids participating in team sports and camps this summer?
Ooh, so I will just say that my children are not. I did not feel like it was worth the risk of them picking something up, especially when, in our home is a little bit different as well. I work in primary care and my husband works in the ER, and both of us are exposed to the public at large on a regular basis. And we were concerned about carrying the virus home and giving it to our kids and then them
Right.
infecting others. So for us, we have decided that just not participating is the safest thing for our family right now.
Hmm.
And I would certainly say anybody who does choose to participate, I would strongly encourage the use of masks to help reduce risk of transmitting the virus, which I know is probably not very comfortable when you're out playing a sport.
Right.
But if you're in close proximity to other people, then you should wear a mask. If you're socially, if you're spread out and you're not close to one another, then it would be safe to not wear a mask. But
Right. And
I
these
would
are
also
questions.
like I would also like to add that, I see a lot of my teens and some of them have returned to their activities during the summer. Check in with your kids often. Let them know it's okay that if at some point they don't feel comfortable attending, it's okay to say so. You don't have to continue to do this if you don't feel comfortable, if it creates more anxiety, if it creates more angst, you don't have to continue to do it.
Thank you both very much for that perspective. Daisy, I find myself in very similar situations where, I might be in a social situation and feel, or get an invitation and feel uncomfortable at attending an event and sort of feel this, fear of missing out, FOMO, as you might call it. But again, these case numbers are terrifying, quite frankly. And I'm sure certainly invite pause for thought. Lori, thank you for your question. I'm sure so many parents are wrestling with the same concerns that you are, particularly as they see, their peers and other children doing things that, seem perhaps a bit riskier than you would hope for your children. Another question from Sarah Thompson. Sarah asks, I read about employees in restaurants, or rather I read about employees in restaurants and bars having to be the enforcers when customers refuse to wear masks. What would you say to business owners who expect their hourly workers to do this in addition to their regular jobs?
I'll take that. I'm sure that is uncomfortable for them to be
Right.
in that position. I also think of, my husband does a lot of screening for his employer, and he certainly has had when people come up and say, well, I don't want to wear a mask. And he is forced to then say, I'm sorry, you can't come into the hospital then without it.
Right.
And so it really is, just allowing them to make that decision of do they want to come into that business or not. And I don't, I know that we as human beings are just oftentimes inherently uncomfortable with conflict, but it really is a public safety issue. And, hopefully people are willing to just say, okay, then I won't come eat here, or oblige and put a mask on.
Daisy, any additional thoughts?
I do. I love that Celeste said people don't like conflict. And something I teach my patients consistently is you don't have to have conflict when you're making your boundaries known, when you are making your when you're having a discussion, or when you have differences. It doesn't have to become a conflict, but so many of us fear voicing that because we're trying to avoid it. So I think that goes more for the guests that are trying to attend establishments who require masks versus the employees who I've already heard have a really hard time having guests actually wear a mask. So just keeping it polite, and it's for the safety of our community.
Absolutely. And we forget oftentimes that wearing a mask is not at all a political choice. People are wearing this not only for their own protection, but Celeste, as you mentioned, for the protection of people back home when they're returning from being out at the grocery store, at restaurants, places where they might not have wanted to have been in the first place, but have to be out of necessity. They're carrying every single contact they had back home with them. So thank you both for that very important reminder. We are getting close, so I will try to pack in as many questions as possible. We had a question earlier. I don't know, Daisy, if you happen to see a tweet from Steve Womack, the incumbent representative from Arkansas's 3rd Congressional District, tweeted a picture this morning of himself on Air Force One, right across from President Trump, neither of the two wearing masks. So the question is, if you were in that position, would you be wearing a mask for the health of not only yourself, but our Commander-in-Chief?
100%. I would be wearing a mask, and I would wait for the picture once we get on the ground where we can be, because in the plane I would be sitting 6 feet apart.
Certainly the ideal. Daisy, we need you in Congress as well. All right, so I have another question. I think this will be our last one to close us out. This question comes from Gwen again. Gwen says, I'm concerned when school starts. The fact that the kids have an option to wear a mask or not seems unacceptable. Why is this a choice? I have several nieces and nephews in schools. And just for a bit of context, Kristen Webb followed up with, all students 4th grade and above and staff will wear face masks when physical distancing of 6 feet is not possible. This is from a statement from Bentonville Public Schools, including school entry, exit, classroom, hall passing at the bathroom. So that's the current BPS statement on the issue, but I'd love to field your two perspectives as well.
So I will just say that I certainly think that our local schools should have the say on what they think should happen based on what's happening in their area. I do think it is a good idea generally to allow for local control unless they're making terrible decisions. So that said, as a parent, I will tell my children that they need to keep their masks on while at school. My youngest is 7. I don't know how well she'll do at being able to keep her mask on her face, but I'm certainly going to send her to school with some hand sanitizer and also strongly encourage her to wear her mask. And I think that there are some good studies coming out that, again, reaffirm use of masks and making sure that there's good ventilation. So whether it's opening windows or having some type of filtration system within the classroom, those things may help a little bit to mitigate the likelihood of the spread, as well as looking at the physical space within the classroom. The reality is we don't really know exactly what the school year is going to look like, and there's a lot of fear and concern over that. The flip side of that too, though, is that what we have right now also comes with a huge cost in the learning opportunities for our children and them getting behind in their academic work. I've spoken to several educators in the area who expressed deep concern, not only about their academic gaps widening, but also children's physical safety. A lot of times the place that abuse is picked up is in the school. And, no one's watching these kids right now. And so a lot of the resources that children have to improve their home safety are not available. They are at home. They are getting behind. Not everybody's getting a structured, safe home environment where they feel safe and are able to thrive. And, I think that's a valid concern as well. And it really is hard in this time to kind of balance public health, mental health, and really being free of abuse in a small amount of children. And so it's really kind of looking at all of those things. And I don't know that anyone has the exact right answer. And as we get more knowledge of this virus and how it's passed on and ways that we can mitigate that, those things may change a little bit.
Now, from the
Daisy, your
social
thoughts?
emotional, social emotional lens, as a social worker, I've already seen so many people say, well, it's the mask is restrictive, I can't breathe, it's uncomfortable. Well, can you imagine what it would be like if you get COVID? It's going to be much worse. I mean, it's not to increase fear, but this is why we're doing it. This is why we're protecting one another. Kids are a vulnerable community. So, from a social emotional perspective, this is an opportunity. What are we teaching our children? What are we teaching our teenagers? What are we teaching each other? Are we going to take this moment to be empathetic and teach one another how to handle a crisis like this? That we are going to be a community united and looking out for one another? Or is it going to be all about me? And I'm uncomfortable and I'm not really sure that this is true. It looks like a hoax, but the numbers don't lie and they keep getting higher.
I would like to just add, as a former ICU nurse, a mask is not real comfortable, but being on a ventilator is a lot more uncomfortable. And I think it is important for us all to do what we can to really protect the vulnerable members of our community.
Absolutely. Daisy, I think you hit the nail on the head. This is a community effort. We are all in this together. The sooner that we start treating this condition the way that it is, quite frankly, the better. I'm old enough to remember the comparatively mild swine flu scare in 2009. I remember afterwards, our desks were spread apart in Fayetteville Public Schools. Every classroom got a hand sanitizer pump, which kids ended up emptying faster than they probably should have to begin with. But I'm hoping that schools do rise to the challenge, that the learning environment becomes one that encourages participation in these community safety efforts. We have seen parts of these reforms instituted before, and I'm certainly hopeful that they come back again in full force come the fall. All right, so with that, would like to extend a hearty thank you to both Celeste and Daisy for being here today and for everyone for tuning in from home. This was such a fantastic conversation. Thank you for your questions, your insights, your reflections. Wishing you both health and happiness this weekend, and hope to see you both in the near future. Thank you so much, everyone.
Thanks, y'all.